It's Ronald Gagliano, R-O-N-A-L-D, last name is G-A-G-L-I-A-N-O. I am the chairman of the Department of Surgery for Dignity Health Medical Group in Arizona and the Associate Chief Medical Officer for Oncology Physicians for Dignity Health St. Joseph's Hospital and Medical Center. I was Lieutenant Colonel, retired as a Lieutenant Colonel, and in the military I served for a total of 28 years, 24 on active duty, where I served as a surgeon and residency director. I commanded in the field and led medical elements in the global war on terror. One of the things the military, I think, does very well is prepare for contingency operations. I served as a medical disaster planner for 2 of the major commands and was trained in medical management of chemical and biological casualties, MIR course, stuff like that. So I worked in those capabilities as well as what you're doing when you're taking your troops downrange, right? So the idea of thinking about supply chain, resupply, all the issues that we're doing here, it's now the same. For a lot of our colleagues, I think this is a scary time, but I think for the military physician, this is kind of like a deployment light. I'm sure you've been out and you have to do your job in the field, right? Out there, not only are you taking care of people in a resource-constrained environment, but people are trying to kill you. You know, here that's not been the case. It's a virus that's trying to kill you, but we can beat that too. What we did is we are trying to address the shortage of the personal protective equipment that's facing the medical community worldwide. Several weeks ago, having seen the difficulty of places we're getting, looking at our own stockpiles, we're trying to figure out what we could do with the resources that we have locally to try to produce reusable PPE. If we were able to do that, then it would cut down our burn until supply chains or whatnot could come back up. So going back to the day where I initially trained, we actually used cloth gowns in surgery. They were sterilized, and knowing that that was probably in less of a demand than other things, we started working with groups to design a garment that could meet the needs across the spectrum of our healthcare providers to protect them from COVID and other infectious diseases while being able to carry on the mission. Ideally, it would be something that would be reusable, it would be cost-effective, but most importantly, it had to be effective in the environments that we were going to use it. So we found a material that kind of meets the highest grade, that's reusable. It's a nominal 100 washes, upwards of 200 to 500 depending on how the material is cared for. And so when you look at it and you look at that material over time, the cost of laundering and things like that, it actually makes it more cost effective than the current price points for some of the disposable stuff that we use. And it's better protection than the disposable stuff that we're using right now. So we were looking for local partners, and we found some people for some other projects that were smaller scale. And it was actually my CEO, Linda, and her team that had put us on to the F.A.B.R.I.C and Sherry and her team for as a group that might be able to help. So I came up with some examples of what I was trying to do. We mocked them up and worked them literally right here on that floor. Came up with our first design elements, went through an iteration, came to the second design element, and today, literally that gown right here, I'll reach out a frame here for a second and pull it up. But this is our, this is literally the first off the presses, and thank you for modeling it, by the way, that we've had. It so far works on all the body forms, the tall, the short, the stocky, the thin, and we've been really happy about it. The material from the cuffs to the main body material is what we call an AAMI3. It just has to do with the level of water resistance to droplet, to water staying, and water under pressure. So that's really a key for defeating this so that the material can't come in. It's very durable and it's well put together. So to cover the majority of exposed surfaces for people that are out there and allow them to be able to be in as well, and it's fairly comfortable to wear as well. So Well, yeah, I think obviously, following the CDC recommendations for social distancing guidelines, masks, clean your hands, clean your hands, clean your hands. It's more to do with bringing material up into your eyes, nose, and mouth than it is about the cough or their sneeze. It's not that that's no risk, but that's how people are really getting it. And so do that. We have, the stations in here to protect the floor, minimizing traffic, follow the social distancing and stay-at-home orders, as people can. That's, I think, really the big thing. And then just be smart and look out for one another. If you have a fever, call in, get checked. If you are being well, thank God, and stay home. For the Arizona National Guard, we're in a huge debt because part of this resource constraint was we found a supplier in North Carolina. It's the only place we could find to get the type of material that we needed. There was no way for us to get the 3.5 tons, nearly 22 miles worth of material that we got without the airlift capacity and the stuff for you guys. And so thank you for helping keep our healthcare workers safe.